everybody. My name is Dr. Sophie Hose, and I am sitting here together with my colleague, Dr. Peter Bauth. We are both chiropractic neurologists working at Georgia Chiropractic Neurology Center, and today we're going to be talking about how we take a brain-centered approach to mental health and healing. So, Peter Bauth.
Yes.
Would you mind introducing yourself a little bit? Tell us about who you are.
Of course.
What you did before this very moment.
Okay.
And
So my name's Dr. Bauth, of course, and I've been in practice almost 30 years now. And it was probably a good 15 years ago where I found the brain-based approach and started integrating that back into my practice at the time, which was very, very, very based in mechanics of the body, the cranial movements, visceral work. And I've always been very fascinated about the body-mind connection. And so I've been working with that for years. And then when I found the body-mind approach and then instilled some of the brain-based philosophies and techniques and ideologies into that, it really, really just expanded my practice and what I could do for people.
So what kind of cases do you specifically work with?
So I'd say about 70% of what I do nowadays involves working with people primarily with stress-based disorders. And the number one stress-based disorder is anxiety. And I'm always very, very clear to tell people that while the treatment itself is not a treatment for anxiety or depression or OCD or whatever have you, it's a treatment for the person with the disorder. Right. And I think that's a really important distinction to remember, is because ultimately whatever gave you the symptoms that you have, we try to look more a little bit to optimizing function of the body, the brain, and working on the cause rather than just the effect.
Okay. Yeah, definitely. So this is our beautiful team here at Georgia Chiropractic Neurology Center. We got Dr. Bauth in the front. I'm in there as well. And in the back, you can see our clinic director, Dr. Mike Ellis. We're all specializing in different fields within chiropractic neurology. And as Dr. Bauth said, he works more with the emotional stress-based conditions. But we work with a variety of other conditions, including concussions, vertigo, chronic pain, dysautonomia, and a broad spectrum of other symptoms as well. So if at any point there's anything that we can do for you, please feel free to reach out to us.
Right. I think it's interesting to note, too, that whether the person's coming because of a concussion, because of a chronic illness, because of an old injury, it can still give you signs and symptoms that you wouldn't necessarily think about. And so one of the things with anxiety especially is people get anxiety following balance disorders.
Yeah.
Right. And so we treat a lot of vestibular problems here, a lot of balance disorders, and people can get anxiety simply because their brain doesn't know where they are in time and space. And that can be very unsettling and create all types of dysautonomic concomitants. So everything is connected, and that's why the team approach that we use here works so effectively.
Yeah, and we'll dive into that a little more further on, but that is a very good point. All right, so this is kind of what we'll be discussing today. We'll start off with a little bit of a deep dive into the limbic system, which is our emotional brain, and then talk about how the limbic system is connected to other parts of the brain. And then really how you work specifically, right?
Within that, sure.
Exactly.
Sure. Well, so when we think of the limbic system, we want to think of a system, right? And so, there's for years this misunderstanding, and we're still gaining an understanding all the time about it, about, what emotions are, what are emotions? Where do they come from? How do they impact us? How do they impact our health? And, what we can do about it when things don't go the way they're supposed to go. So when we say limbic system, we think of aspects of the brain, the temporal lobe, and how that fits into its function with the human body. Things like the amygdala, which is deeply involved in a fear response. And when I say fear response, when we talk about emotionality, it doesn't matter whether we're talking about the organism as a whole or whether we're talking about a cellular structure. As a matter of fact, from a cellular standpoint, when a cell is stressed, it will either move into what's given it growth or away into some type of protection. And so when we study cells, what we're really studying is how we react to stimulus. And so from a standpoint of, I guess you can almost simplify it to a love versus fear. What puts the body into growth? What puts the body into protection? The circuitry behind that, whether it's the amygdala with that fear response, whether it's the hippocampus, which is involved in memory systems, whether it's the temporal lobe, which help us kind of tie things together. It's all involved, and that's what we talk about. That's what we mean when we talk about the limbic system.
All right. I would say let's look at that a little more.
Right. And so you'll see a couple things on here that are interesting. The cingulate gyrus is one. That's always been fascinating to me because the cingulate gyrus will fire the same whether we are experiencing what we refer to and perceive as pleasure or whether we perceive it as pain. And so there's this idea that, oh, this is good, this is bad. And really that comes down to a perception. Mm-hmm. And so, the word perception itself is based in belief. What do we believe is true? And so we can have an individual who has a tendency of thought like this is bad, this is bad, this is bad, but that may have nothing to do with reality. Mm-hmm. Right? And so sometimes people can get a tendency of a thought that necessarily doesn't serve them. And so we talk a little bit about that when people come in and they're dealing with chronic phobias and they're dealing with long-term stresses. The corpus callosum, of course, is that part of our brain that links the two hemispheres together. And so, you can go on Google and look at images of, but, your right brain deals more with like shades of gray and trying to fit the whole picture together. The left brain deals more with like happy feelings and looking at things a little linear. And so that corpus callosum helps us tie both of those aspects together. And then we got things like the hippocampus, which I mentioned, the amygdala, the fear response, the hypothalamus. And so all of those things are part of that limbic response. And they deal with everything from memory to thirst to, protection, etc.
Mm-hmm. Okay.
As well as firing into other parts of our autonomic system, like our sympathetic control, which is what most people refer to as fight or flight.
Mm-hmm. Mm-hmm. So, talking about connections to other systems, can you tell me a little bit more about how somebody that might be struggling with anxiety or similar stress-based disorders could have symptoms that are related to technically completely different systems in the brain, like the autonomic system,
sure,
like the vestibular system? So people that have anxiety, how can it be that they get vertigo from that, or the other way around?
Sure.
If they have vertigo, how can they get anxiety from it?
Sure. Well, the simple answer is all systems are linked in some capacity, right? Mm-hmm. So the brain is the controller and the coordinator of all the other structures, organs, and functions in the body. Be that as it said, you want to look at other systems because sometimes it's easier to talk about individual ones and break them down. Mm-hmm. So like our autonomic system, that's that system that's autopilot, right? So you don't think about digesting your sandwich. You just choose the sandwich, swallow. Now the digestion begins. Mm-hmm. But the reality is that digestive system is also mediated and modulated through the autonomic nervous system that is subject to stress levels. And so if our bodies are under a threat or we are perceived a threat, mm-hmm. then by definition, we don't really want to worry too much about digestion at that point in time. We want to worry about protection. Right. And so certain things will shut down. So peristalsis is the smooth rhythmic movement of the food through our gastrointestinal system, right? From eating to elimination. And that system will slow down if we're under fight or flight. Mm-hmm. Right? The gastric secretions themselves that help us digest, assimilate, and absorb food will slow down. Other systems will amp up, like our heart rate, mm-hmm. right? Like our pupil response, like our lung dilation, because when we're running from the bear, we're not really concerned about digesting our food. And so if we're facing a threat, and in this day and age, all of us are facing some type of minor threat just because of our society, mm-hmm. then the system can get wound up pretty easily and one thing can lead to another.
Yeah.
And that can, by necessity, shift us out of that growth phase into a protective phase.
Yeah.
And so one of the things that happens, and is pretty well understood, is that when we're in that growth phase, most of our blood flow is up to our frontal lobes. And that's where we refer to as like, how are we cognitively? Can we figure things out? Can we make good decisions? But when we're in that fight or flight phase, the shift occurs and the blood is preferentially shifted to our hindbrain. And that's our get out of that area, put up your dukes or run, right? And so that's another aspect of how those two things can coincide.
Right, and I think it's super common, and it's been shown in research and in different clinical studies over and over again. People that have certain disorders that affect their frontal lobe, so the part of the brain that's responsible for higher thinking, like for example a concussion, a more traumatic brain injury, a stroke, whatever it might be. A lot of the time these people end up with anxiety or depression because, yes, in the first place, their frontal lobe might have been the mainly affected area, but because of its connection to the limbic system, we're seeing symptoms there as well.
Right.
And that's kind of it goes both ways. So symptoms in the limbic system can affect the frontal lobe, and symptoms in the frontal lobe can affect the limbic system. And same thing goes for the vestibular system. So people that get vertigo, which vertigo is really just a mismatch of sensory input between eyes, body, and inner ear.
Yeah.
One of those or multiple are off, which gives us this perception of spinning or movement or rocking, whatever it might be. But that sense of instability gives people anxiety a lot of the time. But same thing happens the other way around, right? Sure. Somebody with anxiety might end up with vertigo.
Sure. You hit it on the head with sensory mismatches, and that's one of the things that our exam will hopefully flush out is if we have any of those sensory mismatches. And I think most people, at least adults, have had a certain sense of mismatches in their daily life. Right. I think a real common one is like if you're stopped at a traffic stop and the car next to you starts moving, and just for a second, it feels like you're moving backwards, right? And so, growing up, you've been in a fun house and you've seen those distorted mirrors that make, your torso look really long.
Yeah.
When your brain has a sensory mismatch, it ultimately regards a part of your system as either too much or too little, right? And then so the nervous system is broken down pretty easily to sensory information in. That information can be coming from your vestibular system, your balance centers. It can be coming from your organs. It can be coming from your muscles and joints. And so when the sensory information goes into the brain, it has to get interpreted.
Right.
And then your brain will send out an appropriate motor response to the conditions it's in. If there's a mismatch in that, then somewhere along the lines, you're not getting the appropriate output based on the input.
Yeah.
Right.
Yeah. Okay. So we have 3 graphics coming up, and really, you like this one, right?
I love that one.
So the main question that I get a lot of the time when talking to potential future patients or even existing patients that have not necessarily worked with you yet, the main question I get is, how do you work? Is it talk therapy?
Yeah.
What do you do?
Great question. And so I love this graphic because so many people still in 2026 don't realize that things like upset stomach or cramps or restless legs or just name it has to be related to the nervous system, or can be related to the nervous system, and then specifically for the work that I do, can be involved in that emotional brain response.
Yeah.
And so for years, and still, the idea of mental health is almost a taboo.
Yeah, definitely.
And so for a really long time, people didn't discuss it because they were embarrassed about it. And so when you don't feel as though you're heard, or when you hear, well, that's all in your head, and that's unfortunate, but a lot of people still are believing that these symptoms are in their head because they go for the expensive tests, right? They go for the MRIs and the CAT scans, and which are great because it will help us to verify that there's nothing nasty going on.
Right.
But then they're left with this sense of, well, what's wrong with me then?
Right, because they're being told that everything comes back normal.
Everything comes back normal. And so they think it's in their head, or they've been told it's in their head, which continues to perpetuate that thought process. The reality is, in your head, in your brain. Right? So we look at that a little bit differently.
Yeah.
And then an extension of the brain is obviously the nervous system. Then there's 2 parts of the nervous system, sensory motor. And then there's the peripheral nervous system, the central nervous system, which is your brain and spinal cord. The peripheral nervous system is everything else.
Correct.
And how those things interact with all of the little things that go on every day.
Mm-hmm.
So things like sweaty hands, right?
Big one.
Which will go into nervousness, and people call about that, like excessive sweating.
Mm-hmm.
Well, we hear excessive sweating, but the translation is, how is their autonomic nervous system?
Right.
How the autonomic nervous system can have to do with how their body and how their brain is perceiving stress.
Mm-hmm.
So some of the things that I do are based on adaptive stress patterns and then conditioned stress patterns. In an adaptive stress pattern, I use this analogy all the time. Most people have seen a dog with a tail between its legs.
Mm-hmm.
Most people have seen a cat with the arched back, right?
Yeah.
And so mammals have a very, very common response to a stress, which is you will go into that protection, fight or flight.
Right.
And
which in itself is good.
Which
right?
in itself is good. That's a normal thing.
Exactly.
That's absolutely normal. It's actually it's life-saving.
Exactly. Yeah.
So if you can't go into and engage that fight or flight pattern when you need to, you don't get away from the attacker. You don't get away from the bear, right? And of course, we're taking attacker and bear and all these things, but what we want to remember is that perception of stress is just as real as an actual threat. Right? So what can happen is your body will go into these adaptive stress postures, which again are normal, but they get stuck there. Okay? And quite frankly, we don't even fully understand why some people get stuck. I personally have seen over almost 30 years that it's more of an accumulation of stresses that it's like, oh God, after that thing, I just never was the same.
Yeah.
Right?
Yeah.
And so it's not always just that one wallop that we take. It's that again and again and again. And then you're kind of left kind of deflated. Right? And it's like, oh God, I've never been the same since I got sick back in '84, or I've never been the same since the accident, or since the loss of my so-and-so. Right? And so that's what happens with people as they get stuck in this posture pattern, and then we have to remove that and help their system to restore. Like rebooting a computer, really, but a fancy computer.
I was about to say, you usually describe it as changing the circuit, right?
Yeah. So the circuit is good, you know, and again, when you do the tests, you can see that, look, all of these things are normal. So that tells us that it's a functional problem, not a organic pathological problem.
Right. There's no tumor, there's no stroke, there's no bleed, contusion, whatever.
Right.
But the patient has symptoms. So the way that we usually look at it is, it's fantastic that your scans came back normal, because we don't want a bleed, we don't want a tumor, but you're having symptoms because the anatomy, although it is intact, it's not working the way that it should. And should is maybe not the best word, but the way that it is supposed to.
The way that the system works most efficiently.
Right. So the function is affected, although the anatomy is intact, which is why the scans come back normal.
Right.
Yeah.
Right. Perfect.
Thank you.
Yes, you're welcome.
Thank you. There we go.
And this is actually perfect time for this slide, because it demonstrates the things that we just talked about. So we see a couple of things that we've talked about here from left to right. The hypothalamus, that is our alarm system, right? Now, it does a lot of different things, but for our talk today, we're going to focus on that part. Fair? It also keeps temperature, right? It regulates things.
Kind of takes care of homeostasis throughout
exactly,
the body.
Right. But it's deeply involved in what's called our hypothalamic pituitary adrenal axis, HPA for short. And so when the hypothalamus perceives stress, and it could be a real stress or a perceived stress, right? It will release something called cortisol releasing hormone, which will travel via the nervous system and the blood system, the circulatory system, to your pituitary, and your pituitary will release something called adrenocorticotropic hormone, which travels then through the blood system to your adrenal glands.
Which sit just on top of your
kidneys. And so on the right side of your screen, you're seeing adrenal glands. That's your stress gland. That's going to secrete all those glucocorticoids, those cortisols. That's going to push you into that fight or flight. And once you're there, you're ready for bear, right?
Yeah.
And so that's where you have the increase in heart rate. That's where you have the vasoconstriction, which is just a fancy way of saying the blood shunts away from the things that are not important for survival.
Like digestion.
Yeah. And into the things that are super important for survival.
Right.
Like our hips and our shoulders and our heart.
Yeah. And those are the people where they have super cold and maybe red or bluish hands and feet, super sweaty, like really clammy hands. Right. They're often very pale, and that's exactly what's going on for them, right? The blood is just shunted away from their extremities because that's not what they need for survival. Although they're not necessarily in a survival situation, their brain perceives it as such.
As such.
Right.
And you can see that anytime you've got that HPA axis going, you by definition have a drop in function or a modulation in function at things like your digestion, like your immune, like your mood, like your sexual response. I mean, that's a huge thing. It's a huge, you just turn on the TV and you see commercial after commercial after commercial for things like Viagra's and Cialis and these types of things. And now they're coming out with the equivalent for females, which is to say that your sexual response is something that should take place normally when people are nice and relaxed.
Right.
But if you're in that fight or flight, you're not shunting blood where it belongs at that moment, right? Yeah. So again, we talked about breaking down the sandwich, right? We're talking about appropriate response to an intimate moment. All these things don't take place because your body is in protective mode. And so it's shunting the blood into the extremities, the heart, things that are going to help you protect.
Yeah.
Right?
Yeah, absolutely.
Right.
All right. We got one more.
And so ultimately, we want to look at it. When I started, we talked about we're ultimately a community of cells, up to, I think, 50 trillion cells, right? But our cells ultimately work a very, very similar way. And so when we study cellular behavior, we're really studying us. And what we notice is that we can drop a cell into a petri dish and we can put a little food in there for the cell and it will move, ambulate itself right towards that food. It's amazing, right? But if we put something in there harmful to the cell, we put a toxin in there, the cell moves away from the toxin. And so we do the same thing in our day-to-day life, right? We will go towards the things that are productive for us and recoil in the ways that are hopefully, threatening to us.
Right.
And so that's the difference between growth and protection. In protection, our soma overrides our viscera, meaning to say that we want to be ready.
Yeah.
Right? And so we get the blood shunting from our internal organs of growth, like digestion, externally into our body. So we're ready to fight.
So soma kind of refers to the body.
Soma is the body, right? In growth, we have the opposite.
Right.
The viscera override our somatic system. So that's what we call our parasympathetic function.
Yeah.
Right? Rest and digest.
Yes.
Right? And so instead of fight or flight, we've got rest and digest. And so the viscera, that's where the digestion takes place. That's where appropriate sexual function takes place, appropriate deep breathing, right? That is where that soma can relax. And, you've probably seen it. I've seen it more times than I can remember. The body just feels like a bag of rocks.
Oh, yeah.
Just so much tightness is held in there because of the viscera overriding the soma is gone. And now the person's just in protection.
Yeah.
Right.
Yeah. Constantly. Absolutely.
Yeah.
And we hear it all the time with patients that come in, they're telling us, hey, my neck is so tight, my shoulders are so tight, I get a massage and then it tightens right back up, or it doesn't even help in the first place. Right. I'm stretching, I'm strengthening, I've done all the things, I don't know what to do anymore. And it's giving me other symptoms. Like maybe somebody initially, quote unquote, only has a tight neck, and then eventually maybe they feel the anxiety and depression, maybe they don't, but they end up with vertigo because they're not moving their head and neck the way that they're supposed to. And so there's then other consequences that follow along just from the stress pattern that they're stuck in and that they're not able to get out of.
Sure. Insomnia.
Right.
Totally. People can't sleep anymore.
Yeah.
And then that stuck area starts turning into a chronic pain.
Yeah.
And then the chronic pain can wind up the emotional parts of the brain.
Yeah.
And then the emotional parts of the brain start firing the hypothalamic area that we just talked about.
Right.
And that person can wind up and start having feelings of anxiousness or tension, etc.
Right. So there's really a variety of symptoms that kind of interplay with each other.
Right.
One can really progress into something else or cause another thing. And that's really where we come in as a team and kind of approach everything at the same time
Right.
to make sure that we're not just looking at, let's say, the vertigo or the brain fog or the trouble sleeping, but we're looking at it as a big system. And what are all the different things with all the different providers here that we can do to help our people feel better as quickly as possible.
Absolutely.
And stay that way too, and not have to, get a massage every week, but make sure that their neck is relaxed and they're just overall calmer. They can sleep again. They can do their job. They can enjoy life with their friends and family.
Right. And for me, to put a little bit more of a fine point on it, to be able to deal better with the stress. So a lot of times, like, life is stressful. We've got marriages and mortgages and bills and the outside world and a lot of noise. And so one of the things is we can't necessarily make the world go away.
Right.
Yeah, I've heard it again more times than I can remember. It's like, well, I felt great on vacation, and then I came back, and everything came back.
Right.
So what does that tell you? Well, that tells you that a lot of the things are based in a stress response. Mm-hmm. So I can't make your stresses go away, but what I can do is help you deal better with that stress.
Right.
And if you can deal better with the stress, your life is easier.
Yeah.
Then you're the best aspect of yourself you can be, the best form of yourself that you can be. You're going to be a better mom. You're going to be a better dad. You're going to be a better, husband or wife or whatever it is.
Employee
or employer.
Yeah.
Just better human.
Right.
Right. If you can deal better with and not be at your wit's end all the time.
Yeah.
Things are going to be a little bit better for you during the day.
I would think so too.
All right.
I think that is a fantastic place to end for today. Thank you so much, Dr. Bauth.
I've enjoyed it.
If at any point any of this sounded familiar for you or anybody else in your life, feel free to reach out to us. We do complimentary consults over the phone or in person for you to meet the team, see the office if you would like, and get any questions you have answered to figure out if we're the right place for you. If there's anything we can do for you, even if we could just send you somewhere else, give you another idea of what to do. So we're here. You can reach us by email or over the phone, and you can find us on our website and on social media as well. And we're looking forward to meeting you.
Yes.
From you.
And I'm 100% available if you want to call and talk. There's no obligation. There's no payment, as far as I understand.
No.
There's no consultation fee. We talk over the phone. If it sounds like a good fit for you, we set you up for an appointment.
Absolutely.